Hello everyone, I'm Dr. Amrita Chauhan. I'm a pediatrician by profession. A skin rash in babies is generally what is not normal in the skin is termed as a rash. It might be just a redness over the skin. It might be some raised lesions over the skin. Might be some fluid-filled or pus-filled lesions and excoriation over the skin in the baby. The most common thing which we see in our practice is diaper rash, which is most commonly due to wetness and prolonged use of diapers or recurrent loose motion associated with it. So, this is the most common thing we see in our practice. The next type of rash is in first month of life. There is a benign kind of rash, which is redness or small lesions over the face, which is benign and it's considered as safe. There is nothing to worry in it. Other kinds of rash are viral or bacterial illnesses associated with it. In the most common viral illnesses which we see are measles or chickenpox. We all know about that. They are the two most common viral rashes. And any other viral infections, if a baby gets, it might be considered as a rash generating illness. Then, one more important thing, uh, allergic rash or atopic rash, which we consider, baby has a history of allergy and it gets exposed to that, it might be associated with allergic rash, which is called as atopic rash. It has to be get checked with the doctor because only a doctor, a pediatrician, or a dermatologist can check it. Roughly, we can see the type of rash. Is it just a redness? Is it just a pustule? Is it just a pus-filled rash or area of the rash where it is appearing first? All these things helps in differentiating us what is the reason of the rash. First of all, rash is itself a symptom. And the different symptoms which are associated with it leads to the diagnosis of the main reason of the rash. Just like the rash is associated with high grade fever or running nose or cough cold, it is due to some viral illness. If it is associated with toxicity, high grade fever, it might be due to some bacterial thing. The pus filled lesions suggest bacterial infection. And if the baby has history of other allergies, if the baby is asthmatic or allergic rhinitis, bronchitis, it is suggesting of allergic rash. Rash is always has to be diagnosed clinically, means you have to get it checked by a doctor and you have to get it examined. What is the type, how deep it is, what is it there in it. So it has to be always get it checked by the doctor. And treatment is as per the rash. Whatever is the main reason of the rash, that has to be treated, and rash will get treated itself. So if the baby has got infections, you have to treat infectious things. We have to start antibiotics or antivirals, and local application of some things can be help for soothing the rash. Itching can be subsided by some treatment, but the main reason, whichever leads to the rash, has to be treated. Then only rash will subside. First of all, maintain the hydration of the baby, but never keep the baby in too much of wet areas. Even after taking bath, never keep the baby wet for long durations. He has to be dried immediately. Oiling helps as a barrier, and it can help very effectively to prevent rash. And if there is some other baby which has got infection, we know that that baby has got measles or chickenpox. You have to keep that baby isolated and just avoid the contact to stop the spread of the infection. And if we know that the baby is allergic to something, we have to prevent contact of that allergen, and so that the rash can be prevented. Coconut oil is the best home remedy. It works for many rashes. Diaper rash might works wonders. You have to always apply the coconut oil in the perianal area. This is the best thing which I can advise at home. If it does not subside with coconut oil, seek a medical advice immediately. If the baby is allergic to soap, there are mild body washes available that has to be medicated and harsh chemical free, and only organic products can be used, and that can help them. Otherwise, only use water to clean the baby. Prevention में oiling is the thing. We can prevent it with the help of oiling. Most commonly, every baby gets massage every day, so oiling helps. Then avoid wetness. Uh, regarding diaper rash, as with more than 50% of the rash we see is diaper rash. So change the diapers 4 to 6 hours. The most important thing, do not use talc in the baby. Many parents come and say that we applied talc and the baby's rash is not subsiding. It leads to even more dryness. So always avoid talc in less than 1 year of age. When going out in sun sunlight related rash is also common. So sunscreen can be used after 6 months of age. That is safe for the baby.